In view of the time, we'll skip the report back and we'll let Lorraine tell us a bit more about these hypotheses.
Sorry, I wanted to hear your ideas, but we have to forge. Okay. You can hear me now. So we had the lady at the back of the room there that Brian was giving a hard time. She had an excellent question. She asked me, are there environmental factors associated with oysters? Definitely there are. And in fact, here, the ones with the green checks are the ones that are the most important. So low water temperatures, high rainfall, high river flows, low solar radiation. This all happens over the wintertime. High rain, low light, low salinity, because during periods of high river flows, of course, you dilute out the salinity in the ocean. So all of these things are really important. But before we actually review the results of our plausible hypotheses, I'm going to tell you a little bit about some of these environmental conditions. And so I had some notes here. You know, when we're talking about wastewater treatment plants and are they near shellfish farms, some of them are. So for instance, Nanaimo is kind of near the Bain Sound area, and it has a population of 70,000, just so you know, and it puts out 34,000 cubic meters of wastewater per day in dry weather and more in wet weather. That's a lot of wastewater that's going out, just to let you know. So how is that impacted? Well, the biggest impact is through rainfall. Rainfall is the #1 thing that's correlated to norovirus outbreaks worldwide. It usually, you see a heavy rainfall event before many of the norovirus outbreaks that you see in the northern hemisphere. It's also coincident with colder conditions, and it's associated with runoff and with septic overflows and things of that nature. So rainfall is really important. So what I'm presenting here is a little bit of our search lit review, but then I'm also going to tell you what the situation was in BC as we go along. The other important factor that's associated with norovirus outbreaks, especially associated with shellfish, is temperature. So cold water temperatures is associated with longer norovirus persistence in the environment. And in fact, temperatures below 20 degrees, norovirus can persist for much, much longer. So there's been several studies and documented publications showing this. Also, the metabolic activity of the oysters decreases a bit, and so although norovirus, it takes a long time for norovirus to leave an oyster because of that special binding with the ligand, and we call that depuration. It does occur, but in the wintertime it takes a bit longer. Just to point out, though, we still have norovirus outbreaks at higher temperatures, and they've been documented in Mexico and things like that. But generally, high rainfall, low temperature, are associated with norovirus. So what actually happened in BC? Well, in 2016, and I know this is hard to tell, but we actually had record rainfall in November. So the top of that scale is kind of violety purple, and in November we had near record rainfall. It got a bit drier in December, and in terms of air temperature, it was kind of warm in November, but then it got really, really cold through December and January and February. So we had a lot of rainfall. It could have flushed out whatever there was on land, and then it got really cold. So norovirus was able to survive longer. So let's look at some of these hypotheses. And I know this slide is a little bit busy, but I've put up the numbers for some of the hypotheses that we had at the beginning. So the first one was that we had outfalls near shellfish farms. And this slide is a little bit related to that. So you can have regular sewage outfalls, but you can also have septic outfalls and combined septic overflows or outfalls, where in dry weather, you're just going to get sewage. But if you have all these downspouts and storm drains in a heavy, heavy rainfall condition, the sewage actually is mixed in with the rainwater and it goes out into the ocean. So that was a real concern. But what is the actual issue here? And in terms of combined sewer outfalls, there isn't really that many in the province. It's not that big of a concern. But one of the things we did do
is we contacted Ron Hine, and this is a quote from Ron Hine. He's a registered on-site wastewater practitioner, and he told us that 80% of septic systems in BC are in performance failure. He actually mainly services Langley. So we're like, he's just looking for extra work. He's, we're thinking 80% here? That's not true. So the working group decided that, we should phone up some of these septic operators along the east coast of Vancouver Island and interview them and see what they had to say. And they basically corroborated that there's a lot of people, private, if they have their own private residence with their own septic system, a lot of the old ones, especially for houses built in the 70s or earlier, these are failing. So septic systems only last 25 to 30 years. And the thing is, if your roof leaks, you replace it. If your septic field leaks, unless your kids are playing outside in the summer and it rains, you don't really notice, you don't care. They have seen people piping sewage directly into the ocean. So this is a real problem. So let's see, outbreak number 9 was land runoff and discharge. Although we weren't really so concerned about CSOs, the combined sewer overflows, actually septic became a real issue for us. We think that's a real problem. And I just have a few pictures that Ron shared with us to show us, when he's out there doing these inspections, these are things that he sees. So this, I know it's hard to tell, but at the top here, that's the septic system on the edge of a cliff. And he got called to go service that. And he's like, are you kidding me? There's no way to get to that. And then other things in the field, you can see there's leaking sewage. And this is an example. This is a pipe, a sewage pipe going right into a field, into an irrigation ditch. So this happens, unfortunately, all the time. What else did we learn? We heard people present earlier about marine wildlife. Well, actually, we do have some BC results on sea lions, and thanks to Marty, who I saw here, between the Department of Fisheries and Oceans and the BC Aquarium, we actually did collect 32 samples from Vancouver Aquarium and 6 from DFO. Natalie's lab tested them all. There was one positive, very similar to the one here in terms of it being positive for a G2 norovirus, but it was only 70% homologous to a human strain. So although it looks convincing that there's sea lions all over the shellfish rafts out in the ocean, they're really not contributing norovirus. That's not where norovirus is coming from. So where is it coming from? Well, our main hypotheses were wastewater treatment plants. And this particular article right here, this is again Victoria. We thought this was our smoking gun, Clover Point outfall released a whole bunch of sewage right in September of 2016, which was just before the Tofino outbreak. So we were kind of thinking, hey, maybe this is what caused the outbreak. But what can we say about this? We also had the presentation from Dr. Settle that said, it's possible norovirus can travel on currents quite a long way, especially in freshwater, high freshwater flows. So what do we know? Well, does Victoria dump raw sewage into the ocean every day? Yes. Can norovirus travel hundreds of miles to shellfish farms on the west coast and the east coast of Vancouver Island? Oh, do you know? I don't know. We don't know the answer. We don't actually have the data. We don't have the studies to say whether or not that is the case. So what do we know? Well, flush and forget an inconvenient poop. This is what our working group is coming to. This is a wicked problem. We don't have one smoking gun or one point source outbreak. There's a multitude of problems. So we have issues with local sewage outfalls. We have septic issues. We have wastewater treatment plant issues. We have a lot of things going wrong. And what happened in 2016, 2017 could very easily happen again. We have a lot of sewage going into a marine environment where we grow food. And dumping sewage into the ocean is not a good idea. And we dump lots of things into the ocean. And I think that we have to wake up to the fact that we can't just forget every time we flush the toilet. You know, this is a big public health issue that nobody wants to talk about because, you know, it's not, I know Natalie is excited about diarrhea. But most people aren't, and most people don't want to poop in a jar. And we really need to consider on many, many levels what we need to do to fix this problem. And our working group is putting together a table of evidence gaps, but there's also a lot of other kinds of gaps. So one of the last questions we grappled with at our last meeting was, who do we tell about the problem? Like, who is the most responsible authority for this? We all are, but we don't even know the right people to talk to. Who's in charge? We don't know who to bring it to. There's all kinds of things going on. Septic Savvy, I'm told Island Health has a Septic Savvy program. We probably need to expand that. This is a poster from Transport Canada about don't discharge into the ocean. We did find out that there was a herring fleet right in Bain Sound in February, and they were having a gastroenteritis outbreak on board, but because their vessel is less than 15 feet long, they don't need to have a toilet on board, so everything was going right into the ocean. This happens all the time. So there's another program called Don't Poo in the Blue. We, you know, we need these kinds of educational opportunities, but we really need local and provincial and different levels of government to really think about how to address the problem. So this is the last question, and Eleni, I'm not sure how much time there is there, but we have these options for the question, how should we manage the risk of oyster-associated norovirus? What happens if it starts raining really hard and gets cold again? Are we going to have the same problem? I think so. What are we going to take to reduce the risk?
Theresa, you were going to lead this, but it's 1:30, so we probably don't have time to break out into small groups. Did you want to make a few comments and then go to the last slide?
Sure. So we're out of time, so we won't get to talk about all the exciting stuff at the very end. But I'd ask you in your spare time when you're going home to think about this, if you look on your left-hand side of the slide, we sort of need to think about where we're going to start to address these issues. So at the bottom, we have human illness and an outbreak, and we move up the food production chain all the way to the top at the farm. And for these wicked problems, we need to think about do we want to address them when we already have human illness, or are we going to try and move further up the chain and address them early as possible? And we had a big picture question for the philosophical people and an applied question for the applied people. So I guess we're going to talk now about what the different groups who were involved in this outbreak are doing to move forward to address preventing further reducing the risk of norovirus outbreaks coming as norovirus season approaches once again.
Industry testing?
Sure. So I'll talk about industry. I've spoken to some of the Shellfish Grower Association staff, and of course they feel frustrated by this problem because it's having major impact on their industry, but they don't have a lot of power to do anything about it. At this point, they don't have a test for norovirus that's easy to use and easily available and that they can get results quickly. And the current tests also, you can't tell if the norovirus is dead or infectious. So those are challenges that they face in trying to make sure their product's safe. And there's some researchers on Vancouver Island University who are working to adapt the laboratory methods that they're using now to a sort of more rapid laboratory method, and then that's still in the early phases, and then the very, very long-term goal is to hope to develop some side of a dockside or pen side test so they can tell if their product is contaminated or not. But that's according to them many, many years in the future.
Just briefly, from a public health perspective, BCCDC has been working with our health authority partners here in BC to identify we've worked on 3 initiatives to improve our capacity to respond in the future. One is we are increasing the specificity of our shellfish-related illness investigation, so to be more precise in attributing cases to oyster consumption. Second, we have explored and have identified ways to use the BC Public Health Act to control outbreaks earlier if necessary. And thirdly, we've developed some illness-based criteria for precautionary early closure of farms that could happen based on just reported illness rather than waiting for laboratory tests. Did you want to add anything, Charmaine? No? And then finally, the CFIA is incorporating all of these learnings and all the findings through this outbreak investigation experience into developing guidelines specifically to address norovirus in an updated version of the Canadian Shellfish Sanitation Program. Anything else to add from my partners? Great. So apologies for not having the time to get to the last question. Hopefully this has been some food for thought for you. It was a very challenging outbreak for us, but very exciting, and we're glad to have had the opportunity to share it with you. Thank you.